My name is Brian Burktill, and I'm with Hubbub Health. And just a clarification, we're part of Cambia Health Solutions, headquartered in the Pacific Northwest. We're the parent company to a solution that's working on health and wellness, which I'm part of. And then we're also the parent organization of Blue Cross Blue Shield brands in Oregon, Washington, Utah, and Idaho. And we partnered with our Washington group. So, gosh, don't we have our work out for us? The CDC just came out with the fact that 54% of Americans have abdominal obesity. And what's unique about that is that the male waistline is 40 inches, up an inch. The female waistline is 38 inches, up 2 inches. And I share these stats not to point fingers, but to say I was part of that. 4 years ago when we began Hubbub Health, I was 45 pounds overweight, 4 risk factors, 7 medications. I wasn't at all physically active. And I got these phone calls from my insurance carrier at dinner saying, Brian, yeah, I know I'm fat. Brian, yeah, I know I haven't taken my medication because it makes me feel horrible because I'd have to admit that I'm overweight. And then my company says, hey, why don't you join our pedometer challenge? Here's a free pedometer. Oh, so I can walk with my work colleagues while I'm overweight with my asthma medication because I can't breathe. Okay, that's a motivator. So we at Hubbub thought about this quandary, and we tried to come up with something a little bit different. And we thought about people, we thought about what's important to people, our family and our friends. And then we really thought about how people behave and how we start new habits. And so what I did is I joined this small little challenge called Eat Something Orange. For 2 weeks, I brought an orange to work. I put it on my desk, and that was my motivation. That was the only thing I needed to do. I didn't have to do something for 30 days or 6 months or lose 45 pounds. That was my thing. And so I began this journey over 3 years. And in fact, what I did do is I joined then another 491 challenges in 2-week periods around a holistic approach to wellness and move, nourish, balance, mingle, rewind categories. And I was able to lose all that weight. That's a picture of me running the Boston Marathon, which was my 3rd marathon in 11 months. It's the only one I didn't finish, thankfully. I was 50 feet from the second explosion. So let me tell you a little bit more about Hubbub. We're going to talk about gamification, what it means in business, how we motivate people. I'll share with you a little example of what we're doing with some other groups. And our next slide. So gamification is everywhere, but the problem is we're not engaged. So our employees, not only are we challenged with the fact that we have a few health issues, but we're just not engaged in the workforce. In fact, only 13% of employees are engaged. So what happens when we have engaged employees, though? We're more productive, our business makes more money, they earn more, and employees stay with us when they're engaged. So how could we get employees engaged? In fact, the concept of gamification, through that, we can increase participation with our employee population by at least 60%. And what does that look like? And gamification is this whole concept of driving certain behaviors in a target audience to, or driving actions to change behaviors. But what does it look like if we look at it from a macro standpoint? So we have these 2 sections of gamification, game mechanics and game dynamics. And the mechanics are badges. Many of you participate in a number of different things. You have different levels. We are on leaderboards. We're acknowledged through different gifts or rewards. And then on the other side, we also have rewards, but we have this opportunity to tell people where we stand, our status. We're getting recognition. And we're doing it, the last 2 points there on the right-hand side, self-expression and altruism. And so it ends up being a little bit about ourselves as individuals and less about potentially the company or the plan. And this statement right here from a book that I like, Changing the Game, is all about bringing game mechanics into life. And that whole idea is that gamification can actually be a business solution. We can be more competitive and we can make more money as businesses if we incorporate this concept. So many of you flew here. We were exposed to gamification. I checked in on my flight on Alaska Airlines. What did I make sure they had? My frequent flyer number. Checked in at the Marriott here. What did I make sure they had? My frequent flyer number, because I was able to walk up to the certain line that it was kind of the line of people that have no life away from home. We travel so much. And that's where I walked. But I got to walk up with my Nike Fuel Band. Did anyone see that I posted out that I had 1.9 million Nike Fuel points as a result of my run last night? That's worth something. Okay. And of course, I'm so tied up in the gamification in my personal life. When my wife and I buy our groceries or certain things, we make sure we have our card that's tied to my points as well. So games are everywhere. The concept of gamification we're experiencing in our daily lives. And how could we potentially bring it into, this is Starbucks. I'm so happy I'm on the East Coast, I get to go to Dunkin' Donuts, right? Not get donuts, but get coffee. So Starbucks has me hooked. I get stars all the time when I buy coffee, and I feel good because I get another one to spend more money. So the whole thing about gamification, it's less about buttons and badges, and it's really more about why are we doing this. And so did we tie into our previous speaker really talked about habits. So when we look at gamification, it's making certain that we're sensitive to how individuals create habits, how social influences us, and then why we are intrinsically motivated to do things. And so when you look at levels and badges and being recognized on leaderboards, let's really think about why we're doing what we're doing. We're doing it to hopefully change behaviors. We're doing it to influence individuals so that we're not downstream dealing with high claims and certain issues, that we're really trying to think about on a daily life how we can influence our employees' behavior. And so, what does that look like? I mean, one of our quandaries is that not only are we getting these terrible stats from the CDC and we see reality, but if we look at wellness as only from 9 to 5, people leave the office, we think we're motivating them. That great program that they logged into, you think they were motivated to do something? On the weekend, so people are dialed up. I start my weekend, or most people do, on Thursday night. So Friday people are checked out because they're not engaged, right? So how do I think I can potentially influence them? The weekend comes along, they're totally checked out of our corporate wellness program, but what if we actually looked at wellness this way? And that concept that wellness is 24/7. So how do we connect with employees or members if in fact that's the lives they lead? Well, what if we actually had challenges that were relevant to their everyday life? What if the challenge was actually walk the dog? A 10-minute brisk walk in the morning, wakes them up, gets their blood flowing. What if also, here's an example of some of the other challenges that we run. In our 5 categories, move, nourish, balance, mingle, rewind, what if we did something where we leave work, where do we go? Go home to cook, but before we go there, we've got to go to the store to buy pre-processed food that we can jam into the microwave because the kids are waiting. What if one of the challenges was actually home cooking? And we encourage you and your spouse or partner to plan a meal on a Sunday that's ready for you on one day, and that's your family night. What if also this crazy idea in a balance category called roll, shake, spin, and draw? You actually picked one night a week that you played board games, not boring games, board games with your children. We did this program. How many have gone to Toys R Us or Walmart recently and bought a board game? How much was it? $14. I go to the cheap side. I get them for like $3.99. We did this program as an incentive to our employees. We gave them board games. The cheapest way to get people engaged in real life. And the other thing on the bottom here that leads into really the next phase of how to design, maybe potentially a wellness program that had a little bit of fun, but really centered around family. And the last time how many of you flew out here and said, the last time I was at a conference in Boca 2 weeks ago, and the last time I played tennis was 20 years ago. I had an hour before my next session. Guess what I did? I wouldn't play tennis because I was in this challenge that said the last time I blew bubbles, walked the dog, did whatever. And I said, you know what? Life is too short. I need to pick a few things and put on my the last time I should. The last time which really goes to the next issue of what we're really talking about here. And that is defining or designing a program that's a little bit fun, involving friends and family and spouse. Because really, why does everyone go to work? Because they love you? They love the people at home. They're trying to provide for that. And yet, the boundaries of the program are not enabling that. In fact, we know that when people allow their friends, or programs allow friends, partners, or spouses, engagement is twice as high. One of the things that we're really trying to foster here at Hubbub, through that holistic approach in these 5 categories of move, nourish, balance, mingle, rewind, is enabling people to focus on their adult I should list. You have a to-do list at work, you have the I should list at home. You have equal stress in your life as a result of both lists. Your employees come to work, they're wound up, they're late. Johnny's blah, 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 someone didn't get this. It's because their adult I should list is boiling. Someone misses work. They have a cold, they have some other issue. Why did they get that cold? Because they were so stressed out. They're always doing all the emails and everything that's appropriate. What if we enable people to focus on their adult I should list? So how does this look in real life? Well, our partners at Regions Blue Shield see this. This is another one of our partners. This is CEO of a credit union who was looking for a wellness program, and really his quandary was how we started this session. And so he was really finding a way that they could impact their lives and they get them focused on things relevant to things that were important to them, both in their community as well as their family. And so it was all about doing small little activities. Keep in mind, these activities or these challenges are 2 weeks in duration. People can fathom that. But really the interesting thing about this is you look at these challenges is that across our platform, yes, move is a category of physical exercise, but at most in any company that we're working with, it's no more than 30% of the activities people are doing. People have the freedom to resonate to the challenges that are of interest to them, and they pick things relevant to balance, stress management, nutrition, volunteering. And so that's the uniqueness of providing an environment that allows individuals with their friends and family to have a little bit of fun focusing on their adult I should lists. The future of gamification is really working to fine-tune what I'm going to call the enamoration with buttons and badges, and really define programs that are predicated on behavior design. Why do we want people to chase a level or get to a badge? And to be able to tie things that are intrinsically driven in individuals to do that. And so we've seen it in consumer products. I shared with you a number of those examples. And now we're starting to see more and more of gamification take hold in plans or certain activities relevant to behavior. And in fact, Hubbub we like to think that we're the best, but we're not the only one doing this. There are probably at least a dozen other organizations in the wellness space focused on gamification. Yep, I like that. So the question was, do we have an HRA associated with our program? So people go on hubbubhealth.com, they create an account. If I'm with an employer, I have a code with that, so I'm connected. And what some people do is they just jump in and they find things that are intrinsically motivating them. What we also do though is we have our version of an HRA. It's 10 questions. It takes 5 minutes. It's done online. It's actionable. So as a result of answering these 10 questions, the algorithm is going to recommend 2 distinct challenges for that participant that will be completely potentially different than someone else's responses. And it will be then, so I'll do an example, and let's say I get 5 hours of sleep, which I typically do. So for me, recommended is maybe banish the yawn challenge. So my idea is to get better sleep habits. And from that then is the gateway into a number of other challenges that will be recommended as a result of completing those challenges. And then of course the employer can identify certain things they want for their employee population, maybe on a biometric screening. So Golden West Credit Union found out that their employees had deplorable cholesterol, and so they created Fiber Fit challenges, and they launched them out with some incentives tied into a program that we have to help people focus on that behavior change. Again, all in 2-week increments tied into one another that might have been a lifestyle. Yep, so the question was, does the employer get a report? The employer gets a report based on all those responses, but also at the end of that quiz, individuals were able to ask questions or answer questions. Hey, do you want to work out more? Do you want to sleep better? Do you want to find better ways to get nutrition? And they'll answer all those based on a certain degree of interest. That employer is also going to get that data. And so talk about a survey monkey done right, or potentially, right then you get feedback from your employees. Yeah, so for our program and many others that are trying to do this, scalability, it's all about scale. So what we did is we found a niche that small to medium-sized employers would be terribly underserved with wellness solutions. So our minimum is 2 employees, and we scale all the way up to tens of thousands. But we realized that there was a small niche that was being underserved. And the other thing about our solution and many others is that we realized that HR resources are terribly dear. And so that ways that we can automate things, ways that we can ask questions and give feedback that is relevant to that respondent. So big data is cool, but big data, if it doesn't appeal to Big Bertha or whoever's answering that, isn't sensitive. And so we find ways that we can provide scale to that. The question was, are there certain populations that are more challenging? I mean, clearly because we're mobile, and everything's technology-based. Work populations that have difficulty accessing technology. There are some that I may not use a computer, and I may not sit at a white-collar desk, but we have a few examples. Let's say an auto dealership that has 19 locations around the West Coast. Everyone in that company, from the CEO to the GM to the gentleman or gal who works in the auto bay, they all have smartphones. And so we have native apps that are relevant to that. And so we were able to engage a broader scope of their employee population through technology.